twin pregnancy at 10 weeks. What can you see in this image? Please pause the video now to encourage responses. Here we have labeled two fetuses that each occupy a separate amniotic sac. Only a single placenta is visible. The dividing membrane appears quite thin. Later in pregnancy, the membrane is more difficult to see. Do you see the membrane in this image? Here we have labeled the membrane to make it more obvious. Here is another example of a mono-di twin pregnancy with a very thin dividing membrane. This image is at 12 weeks. Notice that there is no membrane visible in the scan and that both fetuses share the same amniotic sac. This is a monochorionic, monoamniotic twin pregnancy, also called mono-mono twins. This is a scan taken later in the same pregnancy. Again, notice that there is no separating membrane between these twins. It is important to note the fetal lie of the twins as the time gets closer to delivery. Fetal lie refers to the orientation of the fetal spine in relation to the mother's spine and can be either longitudinal or transverse. A longitudinal lie can either refer to a fetus that is head down in cephalic presentation or head up in breech presentation. This was discussed in detail in the 12th video. If both twins are head down, we call the presentation cephalic-cephalic. If the lowest twin is cephalic and the other is a breech, we call the presentation cephalic breech. If both twins are breech, we call the presentation breech-breech. The first word of the fetal presentation description for twins always refers to that of the lowest or presenting twin. The lowest or presenting twin is usually called twin A, and the other twin called twin B. Here we have labeled twin A and twin B in the illustrations. It is useful to have a system for naming the twins when performing ultrasound because certain ultrasound features or abnormalities might only refer to one specific twin. Any fetal presentation other than cephalic-cephalic is at higher risk at delivery. One or both twins can become obstructed or stuck. One or both twins may also have a transverse lie, as we see in this illustration. How would you refer to the fetal presentation in this case? We would call the fetal presentation breech transverse, remembering that the first term always refers to the presentation of twin A. Twins who share one placenta frequently share blood vessels in the placenta. This can result in more blood going to one twin than the other. This is called twin-to-twin transfusion. The fetal death rate in cases with twin-to-twin transfusion is high. In twin-to-twin transfusion, more blood goes to one fetus. Usually one twin becomes much larger than the other. This is a cross-section of the abdomens of twins with twin-to-twin transfusion. The larger twin is receiving more blood and has more amniotic fluid. Notice the marked difference in abdominal size and absence of separating membrane. Which type of twin pregnancy is this? The answer is monochorionic, monoamniotic twins, which lack a dividing fetal membrane. In this image, from a case of twin-to-twin transfusion, the smaller twin has no amniotic fluid, so it appears stuck along the anterior wall of the uterus. Here we have labeled the fetus's head and body to make it clearer. Beneath the twin, the anechoic fluid is actually amniotic fluid surrounding the larger twin. This is another example of a stuck twin from a case of twin-to-twin transfusion. In the left image, the upper twin appears stuck to the anterior uterine wall and has very little amniotic fluid, which is called oligohydramnios. You can just see an extremity of the lower twin, which is surrounded by too much amniotic fluid, called polyhydramnios. Here we have labeled these structures and the thin dividing membrane that can be seen in the right image. Now let's review key points. Which twins are at greatest risk of complications? Mono-mono twins that lack a dividing membrane are at a higher risk of fetal death. Twins that share a placenta are at higher risk of twin-to-twin transfusion. How should you manage a multiple gestation pregnancy? Always follow these pregnancies closely and refer for hospital delivery. A patient will come to your health center for a screening ultrasound at 20 weeks. If it is normal, she should return to your health center for a screening ultrasound at 32 to 36 weeks. If the patient has a multiple gestation, send her images to the referral hospital for confirmation. The obstetrician at the referral hospital will decide when the patient should come back for antenatal care and a repeat ultrasound. If a patient comes to your health center for the first screening ultrasound after 26 weeks and it is normal, you should encourage her to deliver at your health center. If the patient has a multiple gestation, send her to the referral hospital for a repeat ultrasound. The obstetrician will decide how to follow the patient and when it will be best to deliver her. Let's review the key points. Multiple gestation pregnancies are at higher risk than singleton pregnancies. It is easier to determine if there are separate amniotic sacs and placentas in early pregnancy. Complications of a multiple gestation pregnancy include preterm birth, low birth weight, obstructed labor, gestational diabetes, preeclampsia, and placental abruption. Review questions. What are the possible risks of a multiple gestation pregnancy? The answer is preterm birth, preeclampsia, low birth weight, fetal death, placental abruption, gestational diabetes, and obstructed labor. Which type of twins shares the same placenta? The answer is monozygotic twins that split 3 days after fertilization. What is twin-to-twin transfusion? The answer is a condition in which monozygotic twins share the same placental blood supply, and more blood goes to one of the twins than the other. At what gestational age should a woman with a multiple gestation pregnancy go to the hospital for delivery? The obstetrician will decide when the patient is to return for follow-up and delivery. It depends on the type of twin pregnancy and any complications. Thank you for your attention and interest in learning pregnancy ultrasound.